Well, hello all of our lovelies. It's Dr. Melanie Palm from Art of Skin MD, and we wanted to do a quick Instagram live because it is a body boot camp day, and it's our Instagram live where we explain a lot of our sort of virtual open house features. So we always have this spring event, and it's really to get our bodies in tip-top shape because we know right around the corner, hopefully 72 and sunny is hanging out there. So we'll quickly go through some of the devices and some of the specials that we have. Also to note, if you look at our website, artofskinmd.com, and go to our blog entry, the most recent one actually talks about all of the specials we're doing. And make sure you're subscribed to our e-newsletter because we can also send you the most recent drop from that as well. In addition, we're going to have some really nice raffles, and what we're doing today, once this Instagram Live is actually posted on my feed, if you can comment with just what your favorite product or procedure is and put raffle, we will enter you into the raffle, and we will, at the end of the event, at the end of next week, we will select winners and announce them. So with me in the room, I have the gorgeous Christy Cashman. She is our non-invasive body contouring expert, and she is amazing. She's got over a decade of experience in non-invasive body contouring. So we are offering cool sculpting specials, which she is actually been an educator in the past for Cool Sculpting Academy, so instructing other people how proper techniques are actually administered so we get great outcomes. That's the fat reduction technology we offer here. And right now we're actually demonstrating something called Sculpt Neo. And this is typically done as a series of 4 treatments, roughly about weekly. You can do it twice a week though if you want to. And typical areas that we actually treat our abdomen and buttocks. Right now, I believe we've got the flank
got the
on
edge,
there, which has been one of the newer applicators.
applicators.
So, Christy, what area does the edge treat?
So the edge is going to treat your lateral abdomen or your obliques, and then also you get the radio frequency around to your flanks. So you're getting radio frequency all the way around to help with fat reduction, and then you're getting your muscle stimulation on the obliques and or lateral abdomen. That's the part that's going to really cinch your little waist in. On women, it'll give you that little hourglass. On men, it'll give you that nice little V. So this is one of my favorite applicators to do.
We love, and I think Christy has such a lovely approach. You know, there's so many patients that don't want to have downtime.
Right.
They've got excess fat, or they've got excess or a lack of muscle, and we want to address that. So a lot of times, if they have a fair amount of adipose tissue, then we're doing things like debulking with cool sculpting, and then we get to muscle toning at stage 2, because in over a dozen clinical trials that have now been published, Sculpt has been shown consistently, it doesn't matter the patient population, to reduce fat by about 30% in the treatment area and increase muscle mass by about 25%. So we love this device. I use it on my abdomen and my buttock region just because I'm tall and I'm hanging over people. And we do anecdotally hear from patients that it really does help muscle tone if they're losing weight. You know, these GLP-1s are very popular, so patients come to us aware that if they're not upping their routine, they're going to lose muscle mass. So I think this is a great complement to that as well. If you are signing up for the Sculpt Neo, a product that you are getting free with this is something called Body Transform, or the Transform Body Treatment from Elastin. This is a really cool product. We actually were a part of an imaging study with this, actually looking at Sculpt technology, and saw that the treated side, we could increase fat removal by 30 to 50% just by applying this topically. It's got some very novel peptide technology or proteins that help with fat reduction. So this is standard of care, but we're giving it to patients free with this special. So we have kind of package specials with the Sculpt. Certainly with Christy, consultations are complimentary. She's such a wealth of knowledge. So if you are interested in one of these deals, just call us after our lunch hour. We'll be opening up at 1:30 p.m. and you can chat with Christy, who is the guru to all things body. Another popular thing that we do during our open house for Body Boot Camp is Sculptra. So I use Sculptra a fair amount off of the face to help with areas like the buttocks. So if you're doing something like Sculpt to build up muscle tissue, but you want a little extra volume or you want to improve skin quality, we have Sculptra as an injectable. This is polylactic acid, and it stimulates collagen over a series of treatments. But probably my most popular place that I treat patients are on the face. And many people know this. This is definitely a cult favorite for Body Boot Camp. if you're interested in doing body applications or face applications, our offer is you're buying 3 and we give you 1 free, and it's the best offer we ever do here at the practice. Along with Sculptra or any of our injectables, we're also giving patients restorative skin complex from elastin. This is something that I use at night on my facial skin. I really like it. It's been shown in as little as 3 weeks to build collagen and build elastin. Really important to sort of the texture and the elasticity of our skin, so it's great that you get this product along with things. If you're doing a product we're not demoing, something called M-Tone. So if you end up chatting with Christy and you guys decide you want to do something called M-Tone, which is a radio frequency procedure with some acoustic sound therapy that helps with sort of skin textural changes, skin tightening, we are offering as a part of that package the Body Firm, which is a great product from Revision Skincare. I actually mix Body Firm and the Elastin Body Transform as just my body lotions I put on after I shower. I think they're great products, and both of them have been shown to help build collagen and help with elasticity of the skin. So with that, we're going to leave this room. Thank you so much, Christy. We'll see you near the end, and we're going to move next door. And we're going to do a quick little stop off with one of my PAs. And this is Stephanie Williams.
Hi.
And she is one of our old therapy gurus. And old therapy is an ultrasound-based technology. And she is demonstrating something that's kind of a quick, like lunchtime or, short procedure, which is treating the brows. This was actually the first area that was FDA indicated for skin lifting with old therapy. And what we love about old therapy is you can really create bespoke treatment plans. So in real time, we can actually look at the tissue on the screen, make sure that we're targeting the 2 different zones that we want to build collagen in, the dermis and then a connective tissue layer called our SMAS on the face. And we can create new collagen growth through gentle heat, and that helps with the lift over about a 3 to 6 month period. If you've had old therapy in the past elsewhere and it's been a little bit uncomfortable, we truly can change that experience. So we have a lot of comfort measures for patients when they're actually getting treatments done in terms of topical medications that we do, also oral medications and some pain medications to help control things, so that it's a really comfortable treatment. It's a one-time only treatment, so this isn't something that you have to do as a cycle of treatments, but it's FDA approved for 12 months. Duration, although sometimes patients get even a little bit longer legs out of it. If you are doing old therapy, we are actually sampling one of my favorite products to use at night, and the pile of goo that I put on my face, and that's BioSerum, which is a growth factor serum. This one has twice the amount of growth factor as BioCream. It's a really great product. It's got a higher price point, and we're giving that away complimentary if you're doing an old therapy treatment. We also have 2 of our raffle prizes. So we've got an Elastin Care package, as well as some of our private label Art of Skin MD goodies. So make sure after we've posted this that you're actually putting raffle as a comment, and then go ahead and list your favorite either product that we've highlighted or maybe procedure that you'd love to participate in. And then finally, our other injectable special that we're actually doing is a Radius package. So Radius is a calcium-based filler. It can be used on label on the face for jawline refinement, for helping with wrinkles and folds in the face. And also it's FDA approved for hand rejuvenation as well. This is sold as a nice little care package, so you get a nice discount with that. And then, like the injectable Sculptra, we're also offering the restorative skin complex to build collagen and elastin. It's a very popular product. In the same way I use Sculptra on the face, I love to use Radius in the neck. But we also use it in areas that maybe if you have cellulite on the booty, in the banana roll, if there are textural changes. I really love blending this product down with a little bit of numbing and putting it in the area of treatment. It builds in the collagen matrix and it helps to smooth skin. So it's a great product, and we're so excited that Stephanie's actually demonstrating this in real time. What are some of your most common treatment areas that you usually do on a bigger case?
Yeah, so usually, this is FDA cleared for face, neck, and chest. So most of my patients, they like treating the neck along with the lower face. And then what I'm doing on my beautiful model today, we're doing a brow lift. So we see a maximum of a lift of a 1.7 millimeters. So that's a really nice add-on too. So, as you can see, she's super comfortable because we've gotten her done with the topical numbing, and then I actually did a little numbing dot on her brows just to make her more comfortable. And it's nice, it's one of those procedures you only do once, you don't have to do a series. And we've seen patients pretty happy with the results up to a year, even longer. And as Dr. Palm was mentioning, it takes about 4 months to see those changes, where we invite you back in for photos. That way you can kind of see how things are improving. So, I mean, you get a really nice, beautiful lift. You get a nice shrink wrap at the tissue, especially in the neck area. So, most of our patients are really happy with this procedure, and they're super comfortable, as you can see, while we do it.
That's great. Yeah, and we've added on this year because we do so much lower face and neck combined together. So there's actually a package for that. Full face and neck are also really popular packages with this as well. And we're actually combining this technology with the last one we'll show in the next room. So I love recommending for patients doing therapy in the lower face and the neck to help with skin lifting. And then we're going to go next door, and there's kind of like a distant cousin, new technology to M-Sculpt, which is the muscle toning up device on the body, that we now can use sort of a slightly different technology that also tones muscles on the face, and that's next door in M-Face. So a lot of our patients are doing combination M-Face on the face to help tone the mid-face, tone the forehead, and then we're using therapy along with that in the lower face and neck to help tone and lift that area as well. So thank you, Stephanie, for your time.
Yeah.
All right, we're going to keep rolling, and we'll go next door to our final room. And as I mentioned, we were moving from therapy, which is an ultrasound-based technology for skin lifting, and now we're going to talk about a really new innovative device that's called M-Face. We actually were the first practice in San Diego to have it. We got it in November of last year, so we've been treating patients almost for a year and a half.
Yeah.
Several months ago, I think we'd already surpassed 400 cases of treatment. So Christy just really is a true expert when it comes to this. I've had this therapy myself, and we now have a brand new area of an applicator that I'll let Christy talk about in a second. But the traditional areas where the initial studies, there were 7 studies done on M-Face, were on the forehead to help lift the brow position and also soften some of the horizontal lines. And then in the mid-face to help tone muscles. So there's 3 muscles, your zygomaticus major, your zygomaticus minor, and a muscle called your risorius. And these are really important to your smile, but they're also acting like hammocks that hold up the deep tissue support in your face. And they become more lax over time, they become more sinewy, and they don't function as well. And as a result, some of these fat pads that are in our cheek region, sort of in our mid-face or in our buccal region, which is this area of our cheek, start to drop. So being able to tone these different muscle groups helps lift this and gives that pretty S-shaped curve to the face again, which we call an OG curve. So we can see right now we're doing 2 treatment areas. So we're not doing the forehead right now, but we're doing the mid-face to help tone and lift. That improves what we call the nasolabial fold, some of the early jowl formation in the jawline, and sort of smoothing the jawline it helps out with. But we're so excited, and I'll let Christy talk about the newest applicator, which you can see underneath the chin, which we call our submental applicator.
So this just came out in January, and so now we are able to treat the submental area where so many of us have a problem area. And what that's going to do is it actually gets a tiny bit hotter, and so it's going to actually remove any subcutaneous fatty tissue in this area, and then the radio frequency actually comes out this way also, so you're going to help, it's going to help with the jawline as well. And then it also tightens this digastric muscle under this area, which is what helps, like a hammock, like Dr. Palm was saying, hold all of this back. So you're going to end up with a nice little angle there and a little bit less volume under the chin. Again, it goes great with the cheeks because this is lifting up this direction. This is helping under here, so the jawline is going to be beautiful. And
you can actually see that involuntary action. So, from these pads are being emitted 2 technologies. The one that's causing her facial muscles to twitch is high-FES technology. It's high-intensity focused electrical stimulation. And this is specially tuned to get our muscles toned early and stay at a really consistent sort of range of motion and contraction in order to build the most muscle mass. So in the clinical studies, anywhere between about 22 and just shy of 30% muscle mass was improved. You know, I did this last year before I was lecturing at some of our national meetings, and you know, a lot of my friends that are derms and plastics asked what I've been doing. And I really think this has been such a nice addition to what we've been able to do for the face, because especially in women, we don't want to do so many injectables that we would ever bulk the lower face. We want to do things to lift and create that pretty oval or heart shape to the face. So I love combining this with some of the injectable and other technology work we use on the face. It's fantastic. It doesn't hurt. It doesn't require any local anesthesia. It's about 20 minutes per treatment. You can do it once to twice a week, and we're doing it as a series of 6 treatments. The studies were based off of 4, but we found in our practice that patients do awesome with 6. So really excited about this, and it's one of those things that it seems like a science project that's too good to be true, but it really does help, and it's been a real favorite. A lot of our patients that have done initial full face treatment, the forehead and the cheek area, now are coming back to Christy for just maintenance therapy and want to do the neck. So we have a lot of those patients doing that now. And then the final technology we wanted to talk about is behind the camera, and we'll kind of focus in on that, and that's cool sculpting. We talked about that at the very beginning, and this is cryolipolysis or fat freezing.
Exactly.
And it's really one of the standards. There's been, I think at this point, over 120 or 150 articles published in the literature. This is really one of the gold standards for non-invasive fat removal using cold temperatures to basically create an environment that some of the fat cells just don't survive. And because we're doing fat reduction, we always recommend, again, that body transform. So you get a free body transform, which we've got down here on the table. And that, again, has been shown to increase the fat reduction by 30 to 50% beyond what a series of cool sculpting is doing. So important, you know, if we can do simple things at home to really be adjunctive therapy that works and enhances some of the outcomes that we're hoping for from in-office procedures, that's always a fantastic thing. What are some of the most common, I bet I can guess, but what are the most common asks and areas that you're treating?
So I would say the most common is the tummy.
Yeah.
Which get fabulous results with cool sculpting on the abdomen. The flanks are a great area for both men and women. For women, a lot, the bra area is just those little extra areas that we see with the bra, and under the chin we can also do, now we have 2 different modalities to treat under the chin, arms, thighs, but I would say, the abdomen and the flanks are probably just that whole trunk area.
And I think some of our favorite cases are where you're debulking circumferentially around the entire body, you know, forward to back. We're doing that with cool sculpting first, and then we're coming in and really building the corset of the muscles again and doing this muscle toning device with Sculpt. So really fabulous technology, tried and true, have had very nice results, and over a decade and a half of this existing as a technology. So we're going to leave Christy. Thank you so much for demonstrating the M-Face, and we're going to go to just a final little raffle giveaway so that you guys can see this, and we'll talk about our last chemical peels. So Christy also administers our VI peels, and these are really interesting because they have ingredients that are found in a lot of medium depth peels, including phenol and a retinoid. And we're selling it as a series of 3 treatments, and you get a discount as that package. And then along with that, you get BioCream, which is, again, that growth factor cream that helps stimulate healthy collagen. It's very sensitive for or is very well tolerated even in sensitive skin types. But we love VI peels for patients dealing with pigmentation, wanting to get skin a little brighter, building some collagen, and it's actually a really easy peel. It does not hurt when you apply it. You just peel like a lizard about day 3 through 5. So we like that. It's a pleasant one to apply, but I think it yields really nice results as a complete series of 3, and we typically do them about 1 month apart. And then our final giveaway, you can see this lovely basket has got all the goodies from Neocutis, from their eye cream, the Bioserum, which we talked about, their amazing sunscreen, Journey, it's got the NeoFirm and also a BioCream, and you even get a little sippy cup. So wanted to thank you guys all for tuning in. Again, if you'll enter the raffle once we actually post this, if you'll go to the Dr. Melanie Palm Instagram page and write raffle and say what your favorite product or maybe highlight from this was, we'll enter you into the raffle, and then we will pick 3 winners at the end of Body Boot Camp. We are closed right now, but we'll open up again in about 45 minutes at 1:30 p.m. Pacific Standard Time. Please take advantage. We've had a lot of patients already doing that in the first couple of days. And this special will run through next week, and you should be receiving newsletters. You can see lots of before and afters of some of these technologies that we've highlighted today. So I really want to thank you guys for tuning in. We love seeing your smiling faces at Art of Skin MD. And then don't forget to post once we actually put the Instagram live up. Thanks.